All right, Dr. Bridget, we're here and we're going to talk about some interesting subjects. I'm pretty sure. We're going to talk about how are you doing today?
Good, good. So, let me warn you, I brought my dog to work today.
Oh,
So
nice.
I will, if I mute all of a sudden, it's because hopefully not, but I'm giving you a little warning.
Yeah, well, we have sometimes furry friends show up on the show, and that's always
Yeah.
welcome. I have a dog. I
Okay.
love my dog. It's great.
Yeah. Yeah. We'll see.
Yeah, we'll just see, right? It's unexpected. So,
hmm
you were referred to me, I think,
hmm
by Danielle Simone Brand or someone I know.
hmm
Yes.
hmm
And would love to learn about your work in the space of cannabis, plant medicine, and how you got into this. How did this become a part of your life?
Sure. Gosh. Never totally unexpected, I think. But in some ways, exactly what I was looking for. And so I'm a family physician by trade. I spent almost 20 years at the Cleveland Clinic. But I was really frustrated pretty early on in my career. Psych major from undergrad and felt I was going to go into medicine and make it warmer and friendlier, more patient friendly. And I got frustrated. I realized that for all of the education that I had, I really had a factory job in family
Mm.
medicine. So every 15 minutes, diagnosis and a pill, diagnosis and pill. All and it was literally just like I could have been on an assembly line. And I felt like I knew more and that we should be doing things more patient centric, so more individualized type care. And my patients were frustrated as well. They didn't really believe or even then feel like they really trusted the pharmaceutical approach. They were looking for more connection. And so I had like a few patients that I said, if you want to do it differently, let's do it differently. I was putting them on my lunch hour. I was putting them in at the end of the day. I spent more time just knowing them, getting to understand them. And to be honest, it was mutual. They were getting to know me as well because I really took into consideration, years ago, traditional medicine, doctors knew their patients, but patients also knew their doctor, right? And then really helping them understand what wellness meant and what it meant to them. And when they were ready, we started working on diet and exercise and what have you, and really saw amazing changes in taking patients off of meds. One of those patients asked me about cannabis. Thought she was totally off her rocker. And, I looked up information to prove it and I got proved wrong. And so my journey with cannabis really started with this patient that challenged me. And I supported her use and I learned about how to dose and titrate and what have you. And so that is what I saw her health transform in a way that pharmaceuticals would not have done. And that was really the beginning for me.
So I'm going to tail off of that. So what was your experience before this patient? And what were your ideas about cannabis before this that helped you form your ideas initially?
Um, I think as far as like what I learned in medical school, it was all negatives. It was a
Mm.
drug. It makes you stupid. It slows down your productivity. It gives men gynecomastia and there was everything was negative, right? And as far as like growing up, my best friend had an older cousin and I was around them all the time. And she was a wild woman. I mean, she was probably 5 years older and we were like junior high, she's in high school and she always smelled like weed. And so to me, I associated cannabis with really wild, crazy behavior to the point where I never tried it ever. My best friend never tried it ever. We never talked about it. We never talked about it. And it wasn't until I really understood cannabis and I looked at what I understood about medicine, I went to her and I said, I was terrified of this because you're a cousin, but I think your cousin was bipolar.
Mm.
She did not get diagnosed until her late 40s
Whoa.
with bipolar. And she was a teenage young girl trying to manage something going on that she did not understand. I had so much compassion for that. And so, yeah, I had a pretty negative view of it overall.
Feel like we had a very similar upbringing with that or idea.
Mm-hmm.
Like I had a very negative association too until my
Mm-hmm.
mid 30s.
Mm-hmm.
I'm 40, I'm going to be 45 on Saturday. And I feel
Mm-hmm.
like I just feel like I had this weird, I would see things like you did, or I would associate in a way, or my education would tell me this is just terrible, or the marketing, reefer
Mm-hmm.
madness, all this, it's
Mm-hmm.
like, and it just, I was like, are you serious? And once I started dipping into it, I was like, I can't believe this. This is the power of information that is not
Right. Or
presented in a
propaganda.
propaganda. Yes.
Yeah. Yeah. It's the power of propaganda. It's probably one of, I could think of one or two others that we won't delve into, but
Yeah. Yeah.
it's one of the most powerful propaganda campaigns that there has been. Because despite the fact of, we've moved on and we have all the science and information, people still strongly believe in those images and
Mhm.
ideas from the 1940s. And we weren't even born, but you know what I mean? But that imagery, that concept has remained. Yeah.
It's an incredible lineage to pass
Mm-hmm.
on for that.
Yeah.
So after this patient, what started happening when you saw the results, and what was your thought process and how you started shifting your mindset towards cannabis with this patient?
Well, I think number one, it made me look at medicine, forget cannabis, made me look at medicine differently. That here's this incredible option that I completely dismissed that um, if this could do this for this patient, what other things are available and out there that could benefit people that we're not even considering because it doesn't fit into the pharmaceutical model? So I became much more critical, which is our responsibility as physicians, anyhow. But instead of just being the student of the education that was presented to me, I became much, much more critical of what else was out there and making up my own mind as opposed to just going with what I was being told. So I just looked at everything much more critically.
Wow. So it basically opened kind of this Pandora's box for you of like
It did
questioning everything about
everything.
medicine.
Yeah.
Wow. So
Yeah.
where did that lead you then? Like, what was that initial step? Like, where you're like, okay, I need to look at this, or what was the mindset at that point? Like, I'm going to take this one medicine at a time, or one, how I speak
One
to my
patient.
colleague patient at a time. Okay.
Yeah. Yeah. So I think it was prior, before that, when patients would mention any sort of homeopathic, approach, I'd be like, yeah, 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 okay. But if you want to get better, then do this, right? Then I was much more interested and I was much more open to how they were doing things. I reflected more on some of the things that maybe my grandmother would do. Like I just looked at, what we accept is because it fits into a certain model. A lot of what pharmaceuticals are based off are many times based on some of these more homeopathic, approaches, and they're scaled into, a little pill or what have you. But I just started looking at things differently. And so when patients would come in and say, "Oh, I'm taking dandelion root," and I think maybe before I'd be like, "Yeah, okay," but here I'm writing
Mm-hmm.
the script. I would really sit there and say, okay, what is it? How does it work for you? What have you? There was maybe one doctor in my practice that I knew was a little bit more homeopathic and open. So if someone was, beyond what I could really manage, I would actually say, go and see him. But then I started just opening up the door. There was a doctor that was in practice on his own, and he did a lot of like holistic approaches to things, and particularly for my fibromyalgia patients, which I did not feel we had great options for, I would send them to him. Then I learned, of course, years later that probably the best treatment for fibromyalgia is CBD and cannabis.
Wow.
And so, yeah, I really just got more open, but I would take it one patient at a time. Yeah.
Now, what was the when you started delving into this among your colleagues, what was the consensus very similar to what your previous ideas were about this? Or did you have other doctors? You talked about, a homeopathic, more based doctor. Were a lot of your colleagues like, I'm not sure you should be delving into this aspect?
So I didn't share, the cannabis piece in that one patient. I didn't tell anybody about that.
Okay.
Because basically it probably wasn't the most legal thing at the time, but I did pay a little bit more attention to the one colleague that was doing some homeopathic things. I started sending more patients to him because I was aware that he was a little bit more open-minded. So I'd ask a few more questions, but I didn't really share with others my doubt or that I was questioning things, because I was in a very strict and formal medical setting. And I think just being a Black woman in medicine, stepping outside of the most accepted aspects of medicine would label me in a way that I wasn't prepared for. So I kept a lot of my doubts to myself.
So that's really interesting. I want to touch on that. But so when did you start speaking about this more openly? Like, what was that decision like for you?
So when I realized that Ohio was creating a medical program, um, I knew I wanted to be a part of it in some way. At the very least, most of the time, in your life, might be watching some documentary on TV and say, "Oh, I guess that was interesting." Yeah, like you're not even a part of it. And I knew that this was, I had never even foreseen the opportunity to be a part of really a huge movement, a huge change, a huge, like something that was so monumental to something that was so specifically directed towards me as far as medicine, right? And so, so I wanted to be a part of the storm that was happening across America. Never thought it would come to where I was living, but here I was. So, I got involved on that level. And as far as telling anyone about, I didn't tell anybody. Like to be honest, I went to one of my friends at church. And she was, and I started with, I think I'm going to invest in some stocks in Canada, is what I told her. And then express, I think I want to actually see patients. I think I'm going to do this. Was at a dinner party with her and some other friends from church. And I knew they were going to judge me. Like I was ready.
Of course.
But there was a part of me that was kind of rebellious too, right? So I knew my one friend was in my corner. And then I was like, yeah, I think I'm going to invest in stocks. I think I'm going to open a practice, because I knew I did not want to join a card company, because I wanted to do treatment. I wanted to treat it like medicine. I didn't want to do fast cards money. I wanted to do patient care, and they don't do patient care. And I saw one of the women almost like grasp for pearls. And I was like, look at this. This is so crazy. But then in that same moment, she was like, I want in. And I was like, what? She was like, I want in. And she's a nurse. She's obviously, I thought she was very anti-cannabis at the time. And she was like, no, tell me what you're doing. I want to be a part of it. So first of all, you never know who you're talking to. And cannabis is everywhere. And it's probably in people you never would suspect.
It's so true.
And so, so we actually delved into this cannabis journey together in many ways. She traveled, did a lot of research, was thinking about lab and she ended up doing distribution of vaporizers. And I obviously went into seeing patients and developing CBD and talking, doing different things. But she now has a farm in Tennessee, and she's going to start growing hemp. So we've continued on this, sorry.
All good.
We continued on this journey together. And yeah, so you never know who you're talking to.
I mean, you really don't. I mean, what's interesting, I think, maybe I lingered on this a little bit, thinking about the church aspect of it, for myself too. I mean, I think you think that you're talking to someone maybe more spiritual, religious, and maybe like, oh, this is going to be a big no. This is going to be a big judgment. But you just never know who you're speaking with and how they'll receive it. Because on the outside, you're thinking, oh, this, especially in this environment, this is going to be a huge no. This is going to be a huge problem, potentially. And maybe you were thinking that, but we're surprised by the reaction. Yeah, right? I mean, it sounds shocking to me, actually.
Yeah. Definitely. More than surprised. I was definitely shocked. So yeah, go figure.
Yeah, go figure, right? For that. And you educationally, maybe this is an obvious thing, but I don't know. That's why I ask. Like, why is this kind of de-incentivized to talk about during medical school? Why is this not talked about? Is it because of the pharmaceutical link towards this, or the past propaganda? What is it?
Well, first of all, I think it's everything.
Yeah.
I definitely think so. Keep in mind, for probably over 50 years or so, cannabis was part of the pharmaceutical model. If you went to a pharmacist asking for all sorts of different, medications, they were doing compound pharmacy and putting cannabis in a great deal of the medications that were available. I want to say, I probably have the number wrong now, but probably in 200 different medications that were available in the US pharmacopoeia. So at one point, this was not odd. If pharmacists were making compound medications, then apparently doctors were prescribing, these, cannabis as well. I think when the synthetic pharmaceuticals became available is really when the problem started, because they knew they couldn't compete with cannabis. And so, and there was a war, and Mexicans were coming over the border and bringing cannabis. There was a very anti-cannabis movement that was starting. Prior to that, you could go to clubs, and they were called tea pads, and you could have cannabis, and none of this was a big deal. So I think the pharmaceutical aspect is number one. And the propaganda and the prohibition was unavoidable. People could not get away from what that meant. So the fact that we can't get beyond it now is shocking to me.
Well, what do you make of the current state of, I guess I would say, legislation, kind of state by state legislation related to cannabis, both medical and recreational?
Money talks. I think
Correct.
that's probably the best answer. Legislators, lobbyists, I think a lot of them probably could care less, and I will say, even I have a lot of patients that are concerned, if you bring up the religious aspect of it, yeah, they're thinking, oh, I use this and it helps me, but I'm afraid, I'm going to hell or what have you. But the majority of people don't have that, are not conflicted in that way.
Yeah.
And if you do enough research, you'll realize that there is no conflict with your spirituality. And so the reason why we're doing this state by state and it's so slow is because of money, pharmaceutical money, lobbyist money. Yeah, it slows it down.
The pharmaceutical aspect, of it. What is the kind of the major issue with that and related to cannabis? You know, I've talked to a lot of people related to the psychedelics based issue with it, production of it,
Mhm.
but not about cannabis. What's maybe the friction there with the pharmaceutical companies and cannabis?
Um, the well, okay. Basically, if people can grow their own plants
Mm-hmm.
and make their own medicine, you're not going to buy the pharmaceutical medicine. Okay. And the pharmaceutical industry is, multiple billion-dollar industry, right? Now, keep in mind, as we speak, they are creating synthetic and even non-synthetic cannabis medications. I think over time you might not even be aware that cannabinoids are even in them. They will
Mm.
market them in a way that you're not complete. If you know enough, you might be aware, but from it you will not be aware that there's going to be cannabinoids in some of these meds. Okay,
Mm.
they realize that this is beneficial, that there's research that supports it, and they're taking advantage of it. And I suspect in some ways they are probably also working on ways to eliminate the natural plant market
Mm.
so that they can take over this completely. And I think if we're not aware and if we don't stay vigilant, that we will have that the natural plant industry that we've created will literally be somehow erased. I like, and this is, and let me make it clear to your audience, this is simply my thoughts
Right.
and my perspective on this, but I could see something as insane as some sort of parasite, something happened from plants,
Mm-hmm.
and people that have believed in utilizing this become very skeptical. And guess what? You could also get this from the pharmaceutical industry, and guess what? Your insurance will pay for it. And you know what? I'm not going to go this other route because this might make me sick. I'm going to go back to the pharmacy. I'm going to use my insurance, and it will make a huge dent into what we've created so far.
I mean, it's very interesting. I mean, I think it goes back to the monetary aspect of it and pulling people back into the pharmacies
Mm-hmm.
for that. And
Yeah.
with that
Yeah.
being said, though, I mean, what's your most optimistic vision for the future of cannabis, um, and what you're doing?
Mm. Well, I lots and lots of more research,
Hmm.
understanding cannabinoids better, understanding terpenes better, even flavonoids, which is another aspect of the plant. That there is a respect and a space um, to elevate the more natural forms of medicine, and that everything doesn't have to be huge pharmaceutical companies or synthetics, even,
Yeah.
right? That this is beyond even the cannabis piece, that as you see people gravitating more and more to cannabis and just more holistic practices, and 40% of Americans are looking for some other alternative aspect of medicine right now, and that number still grows. Same time, physicians are leaving medicine in droves,
Yes.
burnt out, exhausted. Nurses are leaving medicine in droves. The best thing that could have come from this cannabis movement is a restart and rewiring of the uh, medical model,
Mm.
that we are no longer subjected to this, every 15 minutes patient, diagnosis pill, but that we actually rebel and not just go away and create a model that is more patient centric, and that as that happens, the current medical model won't survive, and they either have to, I guess, change their perspective as well, or go away. I think that would be innovative. and it also allowing different types of practitioners into the medical model, and not just to be kind of sitting on the outside. People want something different, and they should
Yeah.
be able to have access to that.
I see it too, certainly.
Mhm.
And you mentioned rebel. Like, what form does that take in rebelling?
Well, I mean, I think a lot of it now, what I see is that patients either don't take the medications that their physicians are giving them,
Okay.
take the prescription. What I see happen a lot right now, patients take the prescription and they fill it, because sometimes if they don't, um, sometimes it affects, like, if let's say they needed a surgery down the road, if they never had taken the prescription that they were given in the beginning, that surgery won't be covered, let's say, right? So they take the medications, they fill the medications, they put them in a drawer, they take cannabis or whatever other holistic practices, they go back to their doctor. The doctor's like, this is working incredibly. Yeah, okay, whatever, Um, I think, or they don't take the medications at all,
Yeah.
right? And I think that is rebellious, because if you consider many years ago, patients did what their doctors said,
Right.
period.
Correct.
Now doctors are being challenged, and I welcome that, because we're not always right, and we're not listening to the patient. I still believe patients know their bodies better than I ever will. I know a lot of information about a lot of people and a lot of bodies and the science that goes behind it.
Yes.
But on an individual basis, I believe when you're telling me something, first of all, I need to learn how to listen so that I can understand how you say something might be different how someone else says it, but you're both doing the same thing, okay? Saying the same thing. So we need to be better at listening to understand people. But if you're telling me something, I should not dismiss it because it doesn't fit into my algorithm. I need to hear that. And yeah, I think being challenged is a good thing.
Most definitely. But
Yeah.
how does a doctor rebel against this kind of assembly line of 15 minutes, maybe even less how does that
Yeah.
happen? Like,
I think it's like when I was at the clinic, my rebellion was that I would try to get them to allow me to have longer visits, and that didn't really work. I had patients that understood how I worked, and they would make their appointments, and they knew I might not see them for 30 minutes later, 40 minutes. People that didn't agree with that obviously were not, come to see me very often. But there were patients that said, when I get in there, I know she's going to spend the time with me that I need. And so what they couldn't understand was not only was I running late, but nobody was complaining.
mm,
And that threw them a little bit, right? So that was my way of rebelling. At the same time, the fact that doctors are leaving practices and are choosing to be there's a huge movement of doctors that no longer accept insurance, and they're cashed for services
mm-hmm.
practices. It costs sometimes the patients a lot less money. The patients typically still have their insurance, but they're using that for labs and for testing and
Yeah.
what have you. And it allows the physician to practice the way that they feel is appropriate without being ruled and governed by people that are not even physicians, but are more people focused on the money. And I think that's probably the biggest wave of rebellion that physicians are having right now, doing cash for services and leaving the system,
Leaving the
but not
system.
leaving
Yeah.
medicine. They're not leaving medicine, but they're leaving the system.
Wow. I had not
Yeah.
heard of this. Is
Yeah.
this a fairly new development with doctors, or has it been kind of little by little happening?
Little by little, like there's an organization right now that I remember I was spending a lot of time like reading and learning a lot about their information. There are several doctors in the area that I know that are doing the same thing. I do that in a similar way because just having a cannabis practice, obviously I'm not taking insurance,
Yeah.
and cannabis has taken up so much of my time that my goal was always to build a full, a full practice without insurance. But I do take some insurance at the practice that I have now, but a lot of it isn't because and it's cheaper for the patient in the long run.
Interesting. Yeah, I wanted to ask, like, how is it cheaper? And like, what's the mechanism that makes it cheaper? I mean, I don't know. I'm just why I'm asking, you know.
Well, so depending on whether you have insurance or don't, let's say you don't have insurance at all, right? And I have a lot of patients that opt out of that for whatever reason. It's more like different practices do it different ways, but it's sliding scale as far as what you can afford. It's paying for a certain level for the type of medical needs you have. So instead of everyone, paying however much they pay for insurance every month, if you're young and with few medical issues and what have you, you're paying less overall than you would pay for your monthly insurance. You can pay for things a la carte at a rate that is reflective for what it should be. And so patients that enter these practices tend to like the model that it provides.
I see. So essentially, like, if you're a much, let's say, healthier, you don't really need a lot of medical intervention on a regular basis. Maybe your costs will be lower because you're just not someone who's using the service as much for that. Versus now, is it more, we would consider it being like, hey, we're just all in this thing. Like, you're paying, whether you have more chronic issues or you don't, you're just going to pay this thing. Is that kind of what you're saying?
Absolutely.
On some level,
absolutely. Right.
Yeah.
And then for patients that do have more medical concerns, they can buy into the plan that fits their needs. And I think even with them, sometimes it ends up being because you're not having to the insurance company's trying to make money, the physician's trying to make money, the lab companies, like everyone's trying to make money. And where are they getting the money from? From you, right? And so if we cut out some of those players, it will cost less.
Yeah, no, that makes sense. And is there, in this system, is there more transparency in the pricing? Because I think that's one thing that people, I know for me, I don't like getting a bill and I have no clue what it was going to cost. Like, and that is so frustrating. Because everything else in life, you generally know what it's going to cost before you get it. But in this area, it's like, it's just accepted that you kind of really don't know what's going to happen,
Yeah, absolutely. Yeah, I think almost everything else in life, you kind of know what you're in for.
You kind of know.
And then, God forbid, you go to the ER or you have a hospitalization, you haven't a clue what you're in for, right? And if you start asking too many questions, I feel like it just gets more and more complicated.
Yeah.
So yeah, I think there tends to be a lot more transparency with these groups. Yeah.
Yeah.
The hospitals are still the hospitals, but as far as they tend to be more primary care physicians that are doing this. You know what plan you're buying into and you know what you're going to get. So
yeah, that makes a lot of sense. And you mentioned also about that more people, I forget the percentage, are looking for alternative
40%. Yeah.
Right. That seems, I mean, that's getting up there. What is
and that was
pushing?
I want to say that might be data from 2019. So I'd be
it could be
curious what
different.
it is now.
Yeah, it might be very different now. I mean, on a large scale, what's pushing that? Is it just the current medical model? People are fatigue behind it, or what is that?
So they're looking for alternatives. So I think I think number one, distrust, right? Distrust of pharmaceuticals. There's always some, callback of some medication. And as much as they have put a lot in the patient's hands by having there was a time there were no commercials for pharmaceuticals, and now they're everywhere.
Everywhere,
right?
constantly.
Yeah. And so I think that when you see that, sometimes some people are like, I don't know if I want to be back. Like, I want to do that. So people are looking for things that are much more tangible, that they can understand, that they don't see the same amount of risk. with people that spend a little bit more time with them. People still have this image that doctors are being paid off by pharmaceutical companies, which has not been during my lifetime, my career, right?
Yeah.
But that image is still there. And so I think people, I still see people come in with this kind of adversarial type of behavior because there's a lack of trust.
Yeah.
But things that are a little bit more hands-on and things that you can either create or do yourself, at least you know where it's coming from. People want to be healthier as well, I think, in general. And so they don't want to be told always to take this pill. Like I definitely have a patient population where I say, listen, let's change things. Let's get you off these meds. You don't have to take this. And I have patients that say, I'm good, just give me the meds.
Yeah.
But a lot of my patients are like, I don't want to be on those. Like, tell me what we need to do. And so people want to have more control over their wellness. And that pushes people, if you're working with a lot of, physicians or medical community that isn't open to that, you lose faith in what they're providing.
Yeah, man, I have a hope for like kind of this, as medical professionals keep coming along throughout the ages, that they'll have a different take on these things. I think it's part of it. What are the people going through medical school now learning? What are their thoughts about these things in relation to maybe doctors who have been doctors literally forever? And how they just, the generations can sometimes make a big change. So it makes me think of like, what's the future medical doctor need to be like in order to serve the population effectively?
That's interesting because I thought about who was the generation before me. What type of person is drawn to medicine is part of this question, right?
Yeah.
And who was the generation before me? And who are my colleagues? What are they like? And then who are the new people that are looking into medicine as a career? And I don't think we're the same, I think there was always that multi-generation. My dad was a doctor and his dad, and so I'm going to be a doctor. I think some of that still exists clearly, but I think a lot of, I never one day pushed my kids into going into medicine. I wanted them to find what was meaningful to them. So I think you have probably less of you have to do this type of behavior. In cycles of education, we kind of have this wherever, we have this big push, everyone should go to college, what have you. And then we're now in a place where everyone that went to college was like, it didn't really add up that much. And so their kids are now being told, do what makes sense. And if it's college, it's college. But guess what? I know way too many people that were super successful that never went to college. I will tell you, there'll be another swing. So right now with people that have in my generation of kids that are at that age when they're making those decisions, the push for college is not nearly as strong as it was for me.
Yeah, same. Yeah.
So those kids that are not being pushed to college, some of them will become massively successful and say, look, college wasn't necessary. And plus we've had varsity blue and all that craziness that's happened, right? But some of those people won't be successful. And then there's going to be another wave pushing those, well, you know what? If you want to be, you better go to college. So we come through these waves with acceptance of education. There's also, even in the job search right now, where it used to be, did you go to a 4-year college? Employers are more interested in what type of certifications you have, and that the 4-year college doesn't hold the same weight despite the cost that it used to. So it'll come and it'll probably turn back around multiple times again. But I think we're looking at what makes life satisfying in a much different way than we used to. And so the person that chooses medicine, I don't know. I'm curious as you are. How are they
Yeah.
different? Yeah. And
Yeah.
because some of them are going to, some of them are more, there's a lot of push for the MD, PhD, the
Mm.
scientist researcher.
Okay.
And so a lot more programs are developing this dual program, so that the researcher also understands what it's like to be a clinician and understands the patient, because there is a divide.
Most
What you
definitely.
do
Most
in the
definitely.
research lab and what patients are asking for are not the same. I think, you know, I don't know. I'm as curious as you are. Who's this new generation?
Yeah. I feel like there would be more open-minded. I would
I
think
hope
so.
so.
Yeah, that's the hope. I think,
Hmm.
because I've had many clients throughout the years who have been medical doctors, and, I know their children and stuff, and they're
Hmm.
definitely not pushing their children into medicine. In many
Yeah.
ways, they're pushing them away from it and telling what you said, just do what is meaningful for you. And I think that's
Hmm.
a societal change, because and still this is somewhat cultural too. There's certain
Hmm.
cultures where it's like an expectation to be an engineer or be a doctor
Hmm.
and a lawyer.
Right.
And a lot of these cultures are now saying like, well, these people aren't happy doing this. Like,
Right.
what about happiness? And for
Right.
the first
Right.
time, people are actually like, I want to actually enjoy my life and not be
Hmm.
told what to do with my life from birth and then be miserable for what in the end.
Yeah. Yeah. For
That's a
your
big
entire life.
change. Yeah, that's
Yeah.
like a big change, which is going to mean there's probably going to be less doctors because
Well,
of
and that
that.
we are seeing that though, right?
Right?
That the enrollment is not what it used to be. And I told my kids that if you're lucky enough to find a passion, because we don't always, everyone doesn't get that
Right.
opportunity, but if you're lucky enough to find a passion, you will, I have no doubt that you will find security and money in it. Because if
Yeah.
you can, whatever it is that motivates you and wakes you up in the morning and makes you say, this is what I'm meant to do, you will find a way to monetize it in a way that will give you joy and
Yes.
give you money. And so I never really worry about that with my own kids, because I feel it, I was more concerned with them finding a passion
Yeah.
than them making money. Because once they find the passion, they'll make money
I
from it.
feel the same exact way. I have an 11-year-old
Mm-hmm.
daughter, and it's extremely evident what she's into.
Mm-hmm. Mm-hmm.
And I would say, someone who's more artistic, like heavily artistic minded. And
Mm-hmm.
I think in the past we have kind of poo-pooed that. Be like, well, what can you do with that? Like,
Mm-hmm.
you're going to be a starving artist. Like, what kind of life
Right.
is that? And I think
Right.
I like that we're getting rid of that sentiment, because,
Mm-hmm.
listen, they may not become the most wealthy person, but isn't it kind of the goal to be able to support yourself and do, like, it's not, the goal isn't like massive wealth. The goal is support yourself
Right.
and be able to live in the
Yeah.
world and enjoy the different parts of
Yeah.
living and work. And it's like we've had this weird
Yeah.
relationship with work for a long time.
Mm-hmm.
And
Absolutely.
a lot of
Yeah.
people in different generations have just pushed that because the previous generation pushed that. Or this is a
Right.
pension. You're going to have this pension. You're going to have this pot
Right.
of gold at the end of the rainbow, which doesn't exist for most people anymore.
Mm-hmm.
And it's like,
Mm-hmm.
okay, but then you're unhappy most of the time. Like, people are
Right.
just taking that more serious. They're like, this is not a long life. I
Yeah.
don't want to. It
Happiness was never
was
a
never a
part of the
consider, which is
equation.
crazy.
Never.
Never
Like,
a part of the equation.
I really want to say we're really at the first time in approaching a generation that says, "Oh, I want to be happy."
Yeah. It's wild.
Mm, never,
Never.
never. No, isn't it
No.
so sad? It's
It's
so
sad.
interesting now.
Yeah.
Hmm.
It's like, why at this point in humanity have we decided that happiness is important? Because the rest of the time it really wasn't a huge consideration. That's crazy that we've just come to this point in time. We
Exactly.
should be better than
Exactly.
this. Like,
Yeah.
it's like,
Yeah.
it's
Yeah.
wild.
No, that is really interesting. And so, and I hope that we keep that at the forefront, because like I said,
Mm.
societal norms come in waves,
Yes.
and when the tide, comes and goes again, in is even though we should become better humans and more ethical and more humane and more conscious, it's like one step forward, two steps back
Yeah.
a little bit,
Yeah.
I
Yeah.
find, which I don't think I imagined that growing up. I think I imagined, gosh, as if you look at our history and as we grow as human beings and we become more humane, we're going to become this like amazing, altruistic,
Yeah.
like being. But now at this point in time, it's definitely been one step forward is two steps back,
Yeah.
right?
It's not linear,
And
the
so,
progress, it's
oh,
no. It's
oh,
kind of
so
the lesson,
shocking.
right? It's kind
Yeah.
of like, well, there are a lot of good things moving forward, but then you see things that pull back too. It's like, all right, it's going to take some
Mm-hmm.
time,
Yeah.
like
Yeah.
for
Yeah.
that. But
Absolutely.
Dr. Bridget, this was extremely enlightening. And
Yes.
I love
Absolutely.
all the things you said and how you said it, which is the most important. You really thought about it
Mm-hmm.
and were thoughtful. I love that. How can people learn more about what you're up to in this space?
Yes. So you can always go to Dr. Bridget MD.com. And then all of my social media is connected to Dr. Bridget MD as well. So Instagram and Facebook and
Yeah.
God forbid TikTok and all that fun stuff. Yeah, I got coaxed into that as well. So everything is Dr. Bridget MD, and then our book Courage and Cannabis is also website.com and available on Amazon. So you can check that out as well.
Wonderful. Thank you so much for your time, Dr. Bridget. I appreciate you.
Absolutely. Absolutely. Thank you.